Hey guys, I hope you're all well. Today I'm going to answer the 20 most commonly asked type of question that I get asked about shoulders. Now, the questions that I've been asked are mainly to do with the video Understanding Shoulder Pain and How to Fix It, which I've linked just here. So if you haven't seen that video already, I suggest you go and watch it. But all of these questions I'm answering are more specifically based on what I've been asked on that video. So I have sectioned each type of question into a type of category. So the first category is about stretching and exercising. The second category is to do with the type of injuries that you might get with shoulders or shoulder related. The third category is to do with recovery or surgery. And then the fourth category is just any other question that I commonly get asked on that video. Now, I'm going to put the timestamps just here. So if a particular question relates to you, then skip ahead and just watch that one straight away. Otherwise, just watch the video all the way through. That's totally up to you, but you're not going to miss anything if that question doesn't relate to you. So the first category is to do with stretching and exercising. Should I continue exercising if I'm feeling pain? The short answer is no. If you are feeling pain, then I suggest you stop exercising. The chances are that you might have caused your shoulder pain because of exercises you've done. The most common exercises I see that damage the shoulders are a shoulder press or a bench press, usually with a bar. Now, those exercises are most commonly done with a lot of weight. Most people can't lift that weight. So what's happened is they put too much tension through the muscles and therefore put a lot of strain through the tendons, causing a tendonitis. So if you are feeling pain, then stop. Do these stretches help prevent pain or do they help to solve the pain? Actually, they can help with both. It's always a good idea to make sure your flexibility in any part of your body is good. But with flexibility, you also have to make sure you've got stability, because especially with the shoulder is a very mobile joint. You know, it's got loads of range of movement. So you have to make sure that you've got that stability and the strength in those muscles. So definitely stretching is a good idea to prevent injuries. And if you have an injury, stretching will help as long as you're not overstretching and causing more inflammation. So a little bit of stretch pain will be fine, but if you start pushing it too far, then it's probably not a good idea. Should I stretch or will it make things worse? Well, it depends on where you are with your shoulder pain. Now, I categorize pain into 3 phases. The first phase is acute pain or just pain in general. The second phase is mobility and flexibility. And then the third phase is to do with rehab and strengthening. So, will the stretches make your shoulder worse? Well, it depends where you are in those 3 phases. If you're in the acute phase where your shoulder pain has just come on and it's really painful, let's say 7 out of 10, 8 out of 10 for pain, then don't stretch. If you've gone through a phase where the pain has gone down and you're in probably that phase 2 where it's uncomfortable, but it's not causing you that inflamed acute type of pain, that's the phase when you should be stretching. Now, will it make it worse? Well, it depends on what the problem is. I would suggest you go and get your shoulder checked out by a professional if you can. Maybe get a scan if the professional thinks it's necessary. If there is a tear, then potentially you could make something worse. If it's just inflammation around the tendon or inflammation of a bursa or a muscle tear, then the stretches probably won't make it that much worse unless you really stretch it with vigor and a lot of intensity. So if you're starting out with the stretches, then just start with a minimal amount of pain. You should be able to tolerate it, so it shouldn't be agony. So a minimal amount of pain and see how you are a day or 2 later. If there is no pain a couple of days later, then you can carry on and keep trying. You'll get used to how much you should be stretching eventually. And it's a case of consistency. So you don't need to try and overstretch in the first go. So see how it feels, and then if it feels okay, then you can continue and stretch a bit harder next time. How long should you hold the stretches for? Again, if you're starting out, then I would suggest not holding them for too long. 20 to 30 seconds should be enough, and you can gradually build this up over time up to about 60 seconds per stretch. If you feel pain or if it doesn't feel right, then stop. If you start getting numbness or tingling in your hands, again, then just stop and let that blood come back into your hands. Are there any alternatives to the band stretches? Well, yes, there are. The bands are not that important. The position that you're getting yourself into is the most important thing. So based on that video, if you see me with my arm up in the air and leaning into it, then you can use something like a door frame or a bookshelf, but just change the angle and push your chest and head down instead. If your arm is behind you, then again, you can be using a load of shelves or a kitchen counter. Anything that's solid, anything that's going to give you a bit of resistance is absolutely fine. So it doesn't have to be a band. And a TRX also comes into that category as well. So you can use that too. When using the massage ball, does it have to be on the wall or can you do it on the floor? Either is absolutely fine. Doesn't have to be on the wall. Whatever you feel is the most appropriate, whatever you feel gives you the most benefit. It doesn't really matter as long as you can get enough pressure into those muscles. Some of you asked about using the massage ball, and when using them in the back of your shoulder, you feel pain around the front. That is totally normal, so don't panic about that. That's basically where the muscles of the rotator cuff come and attach around the front of your shoulder. So when you press the ball into the back, it's sending pain into that attachment point. So that's totally normal and don't panic. How often should you do the band exercises or the massage ball? I would suggest do it every other day, because especially with the ball, you're causing a little bit more damage. You're trying to break those muscles down. So what you can do is end up with more inflammation. If you're doing it every day, you could end up making that shoulder pain worse. So you need a little bit of time just for that inflammation to calm down. So I would suggest doing it something like Monday, Wednesday, Friday, and then take the weekend off, allow a little bit more recovery time, and then just repeat. So 3 times a week should be absolutely fine. Should I use weights to strengthen the muscles? Yes, you should, but you have to be at the right phase. If you feel like your shoulder pain has gone down and you've moved away from that acute phase and you've gone through the stretches that in that understanding shoulder pain video, and now you need to start strengthening it, then definitely check out my how to fix shoulder pain with this video here. So category number 2 is to do with the joint conditions themselves. Cracking, clicking, and popping. Are these anything to be worried about? The short answer is no, as long as it doesn't cause you pain. Cracking could be something like when you click your knuckles. If you click it and you try and click it again and it doesn't click, then that's probably a release of air from the joint. That's what we do as osteopaths, that's what chiropractors do with joint manipulations. It releases air from the joints, so it allows more freedom of movement through that joint. If it is a repetitive click, let's say you're moving your shoulder in a certain position, and every time you get to that same position you feel a click, the chances are that could be a tendon, or that could be some sort of bony deposit or calcification of a tendon. As long as it's not causing you pain, then it's probably nothing to worry about. If it's causing you pain, do try not to keep putting your arms or shoulders in that position. And other times it can be to do with tension going through the muscle or the tendon. If a muscle is too tight and there's too much tension going through a tendon, then what can happen, instead of it moving through a groove nice as it should, sometimes it gets repositioned. So when you move through that range, it just flicks back into that right position. So that's essentially what the clicking and popping and cracking is. Can neck pain cause shoulder pain? The short answer is yes, and shoulder pain can also cause neck pain. There's a couple of mechanisms behind this. If you are in pain, the chances are there's going to be inflammation. Inflammation will make the nerves around the area sensitive. So that will then refer up into the distribution of that nerve. So you could feel that up into your neck, up into your head, or even down your back. And likewise, if there's a problem coming from your neck and there's inflammation sensitizing the nerves, then that can send pain into your shoulder. It is possible that there's compression on a nerve that could be coming from the vertebra itself, where the nerve root comes out of the spine. Or secondly, that could be coming from a muscle that's too tight. If you get a treatment or a massage, that can relieve some of the tension coming onto the nerves. I would suggest maybe get a professional diagnosis before you just go to someone who doesn't know what they're doing, just to make sure there's nothing sinister. What about weakness and pain following a dislocation? Well, weakness and pain may not necessarily directly be related to nerves, but what can happen is after a dislocation, the muscles might go into a spasm, a bit like a reflex. If muscles have gone into a spasm, that could be compressing a nerve, so that could be giving you some nerve weakness. or it could be a sensation of weakness where the level of pain is just inhibiting the muscles from working properly. But again, go and get a proper diagnosis for that. Torn labrums, Bankart lesions, slap tears, and swimmer's shoulder. Do these stretches, or can these stretches help with any of those conditions? I would say go and get a professional diagnosis before you try any of these stretches. If the problem coming from your shoulder is based on tight musculature and you're not pushing your joints too far, potentially you're not going to do any damage. If you are trying to push your shoulders too far into any of these stretches, you may do yourself more damage. So definitely go and get more of a professional advice first before you start doing any of these stretches. Can a bursitis go away? So first of all, a bursa is a fluid-filled sac that goes between two structures that slide over each other. The purpose of that is just to allow that free movement so it doesn't cause any friction, doesn't cause any inflammation. Itis suggests there's inflammation. So a bursitis means that the fluid-filled sac, the bursa, has become inflamed and probably swollen. This is what's going to cause a lot of people pain, especially when they're coming up into abduction into this range here. So a bursitis will go away, but it will take time. You can get injections for bursitis, but I don't know personally how effective they are. So I would definitely suggest you speak to an orthopedic consultant or your doctor or another therapist who knows more about injections than I do. With a bursitis though, as long as you can keep your shoulder moving in a pain-free range, movement always helps to reduce inflammation, as long as you're not taking it too far and doing more damage. So move your shoulder as much as you can, but don't move into any positions that cause you pain. And eventually that bursitis will go away. So the third category is to do with your recovery. How long will it take to recover and how long until I see a result? Well, it first of all depends on how damaged your shoulder is. So I can't answer that. Generally speaking, shoulder problems that have tendinitis can take between 6 to 12 months. Obviously, it depends on where you are with those phases. So pain, tightness, and then strengthening. What I will say is that the more you put into it, the more effort you put into it, the more consistent you are with your stretches, the more dedicated you are to doing what you've been told, the more likely you are to get that shoulder better in the quickest amount of time. So if there's an acute pain, potentially it could take a week or two. If it's something more serious, such as a tendinitis, you're looking at months. How long will you know if the stretches are helping? I would suggest give the stretches a try for at least 3 to 4 weeks. Be consistent with them, and if there's no change, then maybe you need to look for an alternative. But you certainly will not see any changes in less than 3 to 4 weeks. Can shoulder pain ever fully go away? Yes, it can, as long as whatever's causing the pain is reversible. So if it's something like a tendinitis, a bursitis, a torn muscle, then yes, the pain can go away. If there's something bony causing you pain, such as bony deposits or calcification of tendons, then you're probably looking at more of a surgical intervention. But I have seen people that have had surgery with calcified tendons or calcification around the bones or the joints. I have seen those people make a full recovery. So speak to an orthopedic consultant. Definitely try the more holistic approach first. What I mean by that is the more physical therapy route before you try a surgical intervention. Will chiropractic or osteopathic adjustments solve my shoulder pain? Probably not. Most of our manipulations are based on the spine. You can adjust the shoulder, you can adjust the acromioclavicular joint, but the problems that I see with shoulders come more from the tendons, more from the muscles, rather than spinal. So it's worth a try, but what I would say is don't expect manipulations to make a full recovery for your shoulder. The chances are whatever's going on in your shoulder is coming from the shoulder and not higher up as the primary. So it's probable that there's a tendon or joint, labrum, a bursitis, something that's actually going on in your shoulder. So I would suggest massage, stretching, possibly acupuncture, and then as a secondary, try the osteopathic adjustments as well. So the fourth category is more of an off-topic questions that I get asked. The first question is, can I connect for a consultation? Yes, you can. I can do remote consultations via Skype. If you do want a remote consultation, you can email me at info@precisionwellbeing.co.uk. Also, it depends on where you are around the world. If you're in the United States, the laws about osteopathic treatments is slightly different because an osteopath in the UK is different to the United States. Now, in the United States, osteopaths are prescribing physicians. We in the UK don't prescribe medications. If you're looking for advice, if you're looking for exercise prescription or stretches, then I can offer that no matter where you are around the world. And lastly, can you film other body part videos? Yes, I can. I'm currently thinking about doing a neck one and an elbow pain video. If there's anything that you want to see about any other body part, please let me know. I know a lot of you have found the shoulder girdle model that I used in one of my previous videos very helpful. If you like that anatomy style education first, also please let me know, because then I know whether to explain things in more detail or just give you the prescription of exercises and stretches. So let me know what you guys want in terms of more videos about other body parts. Anyway guys, I hope this video has helped you. If it has, please give it a thumbs up. Let me know how it has helped you in the comments section below. And if you haven't already, please consider subscribing. And guys, stay safe, and I will see you soon.